Have you ever promised a loved one that you would never put them in a nursing home? After the spotlight that COVID-19 put on the nursing home industry with over 200,000 deaths of residents and staff, no one would blame you. But not all nursing homes experience this level of tragedy and loss. And one major reason for that is because some nursing homes had better and adequate nurse staffing. Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse and a nurse practitioner with over 25 years of caring for older adults and their families, primarily in nursing homes. But before we dive into today's topic, I wanted to share a few of the different ways that you can connect with me. You can go to my website, MelissaBPhD.com, and sign up to be an HYSU Insider for free. And there you will find all the downloadable handouts that I've developed for the podcast episodes in one place. And you can also become an HYSU MVP member, and you'll have access to a digital hub of videos, courses, and resources that I've organized by subtopics, which makes it easier for you to find related information that you might be looking for. I also host a monthly live Q&A webinar for my MVP members, and you can also become a podcast member on YouTube. And depending on your level of membership, you get early access to my weekly episodes. You can join me for the live monthly Q&A, or you can tune in weekly for my Live at 5 on Tuesdays. But now let's dive into how nursing homes are putting profits ahead of resident care and some recent activities that should be deeply concerning for all of us. After about 4 decades of research and advocacy about how nurse staffing standards impact resident care, the Centers for Medicare and Medicaid Services finally published an evidence-based rule on standards for nurse staffing in nursing homes on May 10th of 2024. And the part of the new rule that's getting the most fanfare is this requirement that at least one registered nurse be on duty 24 hours a day, 7 days a week. But there's also a financial transparency requirement that goes along with these minimum staffing standards that should get your attention as well. In fact, in the past couple of months, the powerful nursing home industry has initiated major efforts to stop CMS and this new rule from establishing the minimum staffing standards from ever happening. Less than 2 weeks after CMS established the new rule, the American Healthcare Association, or AHCA, they represent all the for-profit nursing homes in the U.S. They filed a lawsuit, and then Leading Age, which represents the not-for-profit nursing homes, they've joined that lawsuit. And this final rule actually represents a much-needed paradigm shift in nursing home oversight to improve quality of care. So in addition to the lawsuits, they have lobbied Congress to introduce 2 joint resolutions, one in the House, which House Joint Resolution 139, and in the Senate, it's the Senate Joint Resolution 91, and then 2 bills. In the House, it's 7513, and in the Senate, it's 3410. And all of these not only ignore the expert advice about minimum staffing standards, but they are targeted to prevent CMS from ever setting any kind of staffing standards. And if passed, these pieces of legislation could mean a continuation of the pattern of poor staffing, where our residents receive unsafe and low quality care. And in my opinion, all residents, regardless of your zip code, are entitled to appropriate professional care, because there's some argument about the difference, that there are different availability of staff in rural and urban settings. But these bills, resolutions, and lawsuits are basically an attack on the legal framework that protects the lives of nursing home residents. So Congress should vote no on these efforts and any others that try to remove these critical protections and minimum staffing standards. But first, you might need a little bit more background information so that you can understand the gravity of the situation. So first, let's talk about what a nursing home is. Nursing homes exist primarily to deliver 24/7 care when a person needs overwhelm what family and friends can provide. Residents receive care from licensed registered nurses and other nursing staff, including licensed practical nurses or LPNs and nurse aides. But we have about 1.2 million older adults that live in nursing homes, and they're both short stay residents that just need rehabilitation, but also long stay residents. If you're a short stay resident, most of the time, most of your bill is covered by Medicare. But if you are a long stay resident, Most of that is covered by Medicaid. The people that live in nursing homes are not there by choice. But they are there because they are the sickest and the frailest of older adults in this country, and they have multiple complex conditions. And the truth is, really only about 5% of Americans require skilled care in a nursing home at some point in their life. So not everybody is going to end up in a nursing home. Let's talk a little bit more about who provides that care. The care that your loved ones receive in a nursing home today is largely not provided by an RN or a registered nurse. And a registered nurse is the only type of nurse that has the educational background and legal authority to assess, plan, and supervise care delivery and monitor the health of nursing home residents to avoid an outcome that would either land them in the emergency room or worse, they could end up dying. And so ensuring that at least one registered nurse is available around the clock reduces the risk of preventable safety events for residents, emergency room visits, and hospitalizations. Right now, the current standard is that nursing homes have to have one registered nurse in the building for 8 hours a day. So now let's talk about a little bit about how nursing homes are paid. So nursing homes accept private insurance and private funds, meaning out of pocket, because if you have a certain amount of money in the bank or a certain number of assets, you do not qualify for Medicaid. You have to spend down those assets. So nursing homes take private insurance, out-of-pocket money, but they're mostly funded through federal Medicare dollars and state Medicaid dollars. And these last two sources are taxpayer dollars that corporations are supposed to use to provide resident care, but a lot of that money ends up in the pockets of their owners instead. Many nursing homes are owned by private equity firms that modify operations to maximize profits. And these companies charge the nursing home whatever their common owner decides. And while only the licensed home itself is required to reveal its finances to the government. So the CMS proposal requires that states do more to track how money each home spends on direct care billed to Medicaid, which is actually the biggest source of revenue for most homes. And in theory, that would help discover which homes are shortchanging employees and residents. So why is the nursing home industry trying to reverse this federal rule in a way that would ensure that no administration can ever set a minimum staffing standard and to ensure that they don't have to be transparent with how they're spending taxpayer dollars? Well, the first reason that the nursing home industry gives is they say that they can't afford it. So with this lack of financial transparency reporting requirements, many operators have mastered this art of appearing poor or broke while their owners are siphoning off money into their own pockets. The most common trick involves owners setting up a bunch of separate companies that offload big chunks of the nursing home business, sometimes management, the staff, the equipment, or the building itself. And what this means is that 77% of nursing homes siphon money through related party companies. For example, they might own the therapy company that provides physical therapy, occupational and speech therapy, or they own the durable medical equipment company. And so instead of the money going towards nursing care, it's actually going more towards these companies. In fact, 66% of nursing home net revenues were spent on direct care. Only 27% of that is licensed nursing. The other part is like nursing assistants. But in contrast, so they spent 27% on licensed nursing and 34% goes to administration, capital, and profits. Right now, the minimum staffing regulation costs only 2% of nursing home regulation or their revenues. Reason number two is that nursing homes say that there's no one to hire. That's clearly kind of a false representation since nursing homes have over a 50% nurse turnover rate. So this means that nursing homes can find people to hire, but they're not able to retain their staff. So today we have this combination of low pay, very few benefits, and poor working conditions. So it fuels this vicious cycle of understaffing and the workforce development. If corporations were to invest in better pay, benefits, and working conditions, nursing homes could attract quality staff to their workforce. In fact, I remember being a director of nursing and telling a registered nurse that her starting pay was going to be $14, and she laughed at me in the face and obviously didn't take the job. she went to the hospital where she was paid like $20, $21 an hour. So there's a big discrepancy in the salaries for patients or residents that are often sicker than people in the hospital. Another thing that happened in September of last year, or 2023, CMS announced a $75 million campaign to increase the number of nurses working in nursing homes. And the recruitment efforts included things like financial incentives to individual nurses, but also tuition reimbursement and developing career pathways so that people could get the education and skills they need to go from being a nurse aide to a registered nurse and stay in the nursing home setting and work there. And this staffing campaign builds on other actions. The Department of Health and Human Services had a health workforce initiative, and that is managed through HRSA, which is the Health Research and Services Administration. But they awarded more than $100 million to train more nurses and to grow the nursing workforce. So the idea that implementing this proposed staffing standard is impractical seems to be an overreaction when 60% of all facilities and most nonprofits meet the new total staffing standard already today. So what can you do? Well, COVID-19 may have temporarily crippled the ability of nursing homes to provide a safe environment for residents and deliver the care that they need. But shame on us now, without a pandemic to blame, if nursing home residents are harmed because Congress caved to lobbying by the nursing home industry to dismantle this new rule rather than protect the lives of these nursing home residents. Without CMS's final rule on staffing, the nursing home industry is likely to continue to exploit this vulnerable population and continue to put profits ahead of care. So please take a moment to write to your representatives and strongly urge them to oppose HR 7513 and the Senate Companion Bill 3410. But also the two resolutions, the one in the House Joint Resolution 139 and the Senate Joint Resolution 91, or any other bill or resolution that would bar CMS from fulfilling its regulatory duty to create safe nursing standards. So Congress should not be allowed to step in and kill a regulation that's the product of thorough and fair opportunity for all stakeholders to have been heard. The nursing home industry had multiple opportunities to provide input on a range of concerns, and they have spent massively on campaign contributions and advertisements. But this new rule by CMS is an evidence-based rule. It's based on decades of publications. For many decades, health researchers, geriatricians, nurses, and other clinical experts have recommended minimum nurse staffing standards to improve the quality of care being delivered in nursing homes. There's been a wide range of peer-reviewed literature that has demonstrated the causal connection between higher staffing and higher quality of care in nursing homes. And as far back as 2001, CMS noted a strong and compelling evidence for having minimum staffing standards, even in an economy with a chronic workforce shortage. And then in 2022, there was a panel convened by the National Academy of Science, Engineering, and Medicine that also recommended minimum staffing standards to improve the quality of care in nursing homes. These resolutions and bills should not ignore this expert advice that would prevent CMS from ever setting any kind of staffing standard. Because if passed, these pieces of legislation would mean a continuation of the poor staffing in which residents receive unsafe and low quality care. And all residents, regardless of your zip code, are entitled to appropriate professional nursing care. So thank you for listening. I hope that you, if you would like to write to your legislator, you can check the show notes here, go to my website, to this episode so that you can get the actual name of the bill so that you can include the bills and the resolutions when you're writing your representatives, and that will be greatly appreciated. So thank you for tuning in today. Please share this widely, especially if you know someone who lives in a nursing home or a family that has a loved one in a nursing home, because we have to be just as loud as ACA and Leading Age are being, because this legislation needs to go through. It's not that much of a reach to add, a registered nurse for the additional 16 hours so that someone is in that building when a resident has a crisis and needs to be evaluated by a registered nurse to prevent a bad outcome, including death. So I hope you will join me in this campaign to make sure that nursing homes are not allowed to put profits over nursing home care. And I will see you for the next episode.